Well, good afternoon, everybody. It's an honor to be able to host this great announcement this afternoon. And I also want to thank you all for joining us, Premier Kinew, Minister Asagwara, and as well as Elise Lathlin, Amanda's daughter. So as always, I always like to start off, and I'm proud to acknowledge that our community of the town of the Pas is located on Treaty 5 territory, and that's the ancestral lands of the Pas-Kameesak Cree Nation, as well as many other Indigenous people, and as well as the homeland of the Red River Métis. I'm grateful today that the Premier and the Minister have joined us in the PA for this important and awesome announcement, and it's one that I know our community will welcome, will be welcomed. Today marks an important step in forwarding, today marks an important step forward in expanding access to primary care in the Pawn area, and with that I'll invite the Premier over to say a few words.
Awesome. Thank you, Mayor. Yeah. Well, thank you, Mayor Murphy, and thanks for doing the land acknowledgement and including OCN. Thanks everybody here who's joined us today. It's nice to see everybody. So we are here to announce that the new primary care clinic in the PA is going to be named after our late colleague Amanda Lathlin, and it is going to be called the Amanda Lathlin Memorial Clinic. Now we all know that Amanda was the late MLA here in the region for the Pas-Kameesak, but she was also a trailblazer. In 2015, she became the first First Nations woman elected to the Manitoba legislature, and she served there alongside us for more than a decade. Along the way, healthcare for Northerners was one of her top priorities, and so it's only fitting that the clinic is going to carry her name and carry on her legacy. Now, over the years, she was advocating for the Northern Patient Transportation Program. She was advocating for better access to healthcare supports for survivors in northern Manitoba. She was also an advocate for the PA to get this very clinic. And so when we included it in the budget this year, we knew that this was an important step to paying tribute to the late Amanda Lathlin. So I want to thank her daughter Elise for being here with us today, and hopefully you and your family are going to be very, very proud to see that sign up in the PA for many, many years to come. I also want to thank Mayor Murphy, because the town council here in the PA passed a resolution unanimously calling on us to name the facility after Amanda. And when we received that letter, I can tell you our whole team was very, very honored, very, very happy, and of course was very moved by the gesture. And so really, Amanda had put in the work, her family put in the support, and it was the community leadership here in the PA who asked for this honor to be bestowed upon Amanda. So we know that as we move forward, that this facility is going to have a big impact in the region. People need to be able to access healthcare close to home. People want to be able to get to the doctor, to see a primary care team, and to have their needs looked after. And I also know that folks in the PA and the region don't like waiting. And so while this facility is currently scheduled to open in 2030, why don't we work together and speed up that timeline?
That's great.
Miigwech, merci. Thank you very much.
Thank you so much. So I just heard 2028. I just put that out there. Thank you, Premier. Again, Amanda was a pillar of our community, and naming this facility in her honor will ensure her legacy will endure. And also that future generations will know her name, learn her story, and be inspired by all that she's accomplished in her tragically brief time on this land. Now I'll invite Minister Asagwara to provide a few remarks.
Thanks, Mayor. Appreciate it. Thank you. Thanks, everybody, for joining us for this really special announcement. I'm really grateful to be able to be here with all of you today. for the official naming of the Amanda Lathlin Memorial Clinic, especially very touched to be able to be joined by her daughter, and granddaughter is here as well. As you all know, Amanda was a trailblazer. She was a leader. She was a tireless and pretty fearless advocate for healthcare in the North and for her community specifically. She broke new ground as the first First Nations woman elected in Manitoba. She took a number of steps to make sure that healthcare for her community and for many communities was moving in a better direction. And she was a friend. You know, she was a colleague, she was a friend, she was somebody that we cared about deeply and who reminded us on a regular basis how important it is for us to do everything we can to ensure that those living in the North have the best chance at a great outcome. And we believe as a government that every Manitoban deserves timely access to care, and care as close to home as possible. Whether you're in downtown Winnipeg, you live in the Pas, or any northern community, you deserve access to the services you need when you need them. And so this step today is about us reinforcing our focus on supporting northern communities, making sure that you do have that care close to home. We know that there's been a lot of work that's been done to make sure that we are moving healthcare in the North in a better direction, to make sure you've got better care in your own communities. But we also know there's more work to do, and that's why this clinic says a lot to people who've been advocating for this for a long time. We know we need to open not only this clinic, and it's going to be innovative, it's going to be state-of-the-art, it's going to be a pretty remarkable facility. We also know we need to do more in terms of capacity and diagnostics in other spaces as well. And we've made a commitment to improving access to care in our healthcare system, and we take that very, very seriously, no matter where you are in Manitoba. So folks will know that last year, actually, we launched our mobile MRI service in the North. That was a really important step. It brought MRI capacity to the North for the first time ever, and I'm very happy to share that as of August 24th of this summer, the Pas will start seeing that mobile MRI service and providing care to patients right here at home. So not only are we doing the work to fix healthcare, we're doing the work to strengthen it for generations to come. And that is Amanda Lathlin's real legacy. It's about improving healthcare and strengthening healthcare and services for future generations of Manitobans. And as the Premier has already said, we're going to keep working hard, but of course working as quickly as we can to make that happen. Mayor Murphy, I see you're 2028. We're going to work as quickly as we can to make sure that the Memorial Clinic in Amanda Lathlin's amazing honor is opened as quickly as possible. Thank you, folks.
Thank you, Marcia. So I just heard us, shave a few months off that date there. So thank you so much, Minister. And I know as Health Minister, you've been working hard on all these issues, and especially in the last few years, to ensure Manitobans can, as you mentioned, access care they need, no matter where they live, and always closer to home. We know that people in northern Manitobas and remote communities continue to face unique challenges in accessing care, and that's why this facility, the Amanda Lathlin Memorial Clinic, is so important. And now I'd just like to ask Elise to say a few words.
I just wanted to share something personal about my mom. When we were driving around past Oscar Lathlin Collegiate, the high school in Pas-Kameesak Cree Nation named after my late grandfather, I asked her if she thought that anything would be named after her once she's passed, and she told me that probably not, and she brushed it off and said, I'm not that important, I don't think anything like that. So I wish I could tell her that she was wrong and that she's being honored today. And this is the photo from the Manitoba Legislative Building. This is what sat when she had the ceremony. So I will be gifting the Pas Council with this to put in the new clinic that's going to be built in hopefully 2028.
We're lined up.
Thank you.
Good job.
See, we're all lined up already, so thanks so much, Elise, for your words. And I know this is both a meaningful but difficult day for you and your family, and we sincerely appreciate you being here with us. So once again, to the Premier, thank you. To the Minister, thank you so much. We know that everyone here, thanks for making this day a special day. It really is a privilege to recognize a cherished member of our community, such as Amanda, who has been taken away from us way too soon. And as mentioned already, I always say Amanda was a strong and passionate advocate when it came to health care in the North, and a woman who helped many, made history, and whose name will now live in a space where that continues to provide cares for Manitoba for generations to come. So on behalf of myself and our community members, thank you all for being here. And I'll now pass it to open the floor for some questions, right?
Well done.
Speaking a little bit about the facilities that's supposed to be updated or open for another couple of years, what are we looking at in the process right now? Or do we have deadlines or like any sort of guidelines for construction or design or anything of that nature?
Would you like me to answer that?
I can tackle that one. Okay, all right. So the timeline is 2030 for first patient day. Obviously, we're going to work as quickly as we can to see how much time we can shave off of that. We've actually been allocating money in every single budget for this project. So we've been going through the process of acquiring the necessary land, securing what's necessary in terms of making sure we have the right footprint for this clinic. And now we've set money aside to really take some of the bigger steps, including design. So we're currently in the design phase. As you can imagine, this is a clinic that's been here for a long time. And we're not just thinking about what the community needs right now or is going to need during the time that it first opens, but we're thinking about the future of healthcare in the Pas and in the North. So we want this to be an innovative facility. We want this to be something that attracts, not only retains, but attracts, the best and the brightest in healthcare. So that design work is underway.
We have a question from media now.
Was there a location already selected for the clinic? Has that been sorted out or is that still in process?
Yeah, so the location has been identified. Again, we took the steps to secure the land. We did that as early as possible to make sure that, again, we had the right size footprint for this. And now the design work is underway to make sure that we have a full appreciation of all the services that are going to need to be in place, including likely an enhancement and expansion of existing services. So we're working with Shared Health to make sure that we've got the right diagnostic infrastructure in place, that we're looking at meeting the needs of primary care. We're looking at meeting the needs in terms of prenatal and natal care. Like there's a lot of services on that continuum of care that we need to make sure are built into this project. And so all of that work is being done now.
I have a question for Elise, if it's okay. You've mentioned the story, the conversation that you had with your mother about will anything be named after you. How do you feel seeing this happen today?
I feel really honored, and my mom just recently passed in March of this year, so to have an announcement this soon to honor her legacy is remarkable. Like, I'm proud that I can tell my little sisters that, even while she's gone, stuff in her name is still happening.
I've got one more. This is fulfilling a need within the Pas. I also know that there are other healthcare needs in other northern locations. I'm wondering if what would be another major priority for other northern communities or major centers? Like, what's the next steps in addition to the clinic here?
Sure. Sure. That's a really great question. So we have taken a number of steps across a wide variety of areas of healthcare needs. So certainly in the diagnostic space, As I said last year, we set up the first mobile MRI so that the North would, for the first time ever, have MRI capacity, which is, we're going to continue to build on that. The PA will start seeing their first patients get their scans on August 24th, which is wonderful for this community. And we've taken a number of steps across the North to make sure that we fulfill a couple of things. One, we want to repatriate birthing services to communities. That is work that we started from day one. That is work that is ongoing. We're working directly with the Northern Regional Health Authority to make sure that we're supporting people and being able to give birth in their own communities. That is a priority, and we'll continue to do the work around that. We've also stood up more training seats for healthcare workers in the North, because the most important pillar in terms of us being able to successfully have more access to healthcare is having more people to deliver that healthcare at the bedside. So we have more seats for nurses, for paramedics, for healthcare aides. Right now, there are strategic plans being developed for the PA. That plan has actually been developed and is now being fleshed out in terms of what does staffing and human resource for the PA really need to look like in the immediate and the long term. The same is being done for Thompson. And we're working directly with communities to address dialysis services, making sure that we are working with First Nations so that they can stand up dialysis services in their own communities with the full support of our government. So there's a number of different ways in which we are enhancing healthcare in the North. We have made it a priority. We are going to continue to focus our efforts on making sure that folks in the North have care right at home or close to home. And that's a big pivot from years of cuts and divestment away from the North that unfortunately folks are still dealing with. But this clinic today, this announcement of the Amanda Lathlin Memorial Clinic, I hope really shows people that not only are we committed to making these investments for the immediate and the long term, but there's a value attached to that. There's an approach attached to that hopefully can inspire people and remind them on a regular basis that the voices in the North matter and that they're being heard. Oh, apologies. You can go to Zoom.
Yes, hello. Thank you, Minister. Two reporters on Zoom. We'll start with Morgan Majesty from the Winnipeg Free Press. Morgan, one question, one follow-up.
Hello, Minister. Thank you so much for taking our questions today. And my apologies if I had missed this. There was a little bit of tech issues on my end. Could you just go over the cost and funding associated with this clinic? Maybe just tell us a little bit about the overall cost of this clinic from kind of design to construction. And again, my apologies if I had missed it.
Yes, absolutely. Happy to talk about the cost. So as I said, we have allocated money in every single budget for this clinic. The money initially was to secure all of the land that was necessary for this project. We wanted to make sure that we had the right size footprint for the new clinic. And now we're in the design stage of this process. In total, right now, we're looking at about $50 to $60 million being allocated for the build of the Amanda Lathlin Memorial Clinic. That number could change. I'm sure my department wouldn't like me saying that. They're probably itchy right now, but $50 to $60 million is the range that we're looking at to build this clinic.
Thank you so much for that, Minister. And, talking a little bit further about the need for these types of institutions in the North, do you hope that this type of a clinic becomes a hub for the North when it comes to folks who are needing medical care? And what is the need in the North right now for a facility like this, Minister?
The short answer would be yes, definitely. We know that the PA kind of already does operate as a bit of a healthcare hub. We know that there are many communities that depend on capacity in the North, specifically here in the PA rather, so whether it's their emergency departments or other primary care services. So the hope here is that we establish a clinic that is, again, innovative, that is future forward, that is able to retain and also attract folks to the PA, to the North in terms of getting health care expertise here on the ground, but also that we stand up, the best primary care that is possible. We know that if we want folks to have healthy outcomes long term, that they have to have a healthy start in life, and they need that continuum of care throughout their life to be very strong. So our priority is making sure that this clinic has a very, very strong and connected primary care model, and that the vast majority of services that folks need, they can either receive here in the PA, or there's a direct connection to those services to that clinic if they're somewhere else in Winnipeg or Thompson or somewhere else, specialty care, that allows for folks to be connected to that care while remaining in their own community. So this is a really, really exciting opportunity we have in front of us to make sure that this clinic is going to support the expansion of critical services, but also to build on that in an innovative way that will really, really benefit care for the long term.
And up next from the Pas-Kameesak Star Times, Jennifer Laviolette. One question, one follow-up.
Thank you. Minister Asagwara, can you tell me approximately what kind of square footage we're looking at for this clinic?
You know what, I can get you some detail on that offline. I can tell you that it'll be larger than the existing footprint. The design phase that we're in right now is to determine that. So the work is being done right now to determine what additional services this clinic is going to need, what sort of footprint we're going to need for every single one of those services, and what the opportunities are. So we anticipate the footprint will be greater, but most importantly, it's going to be about what services are housed there, and we're going to have to start doing the work right away of recruiting the healthcare workforce to staff this clinic. So that work is going to happen simultaneously.
Perfect, thank you. And my follow-up question is around services. When Minister Lathlin used to talk about sexual assault victims in the North not being able to access sexual assault detection kits, and that they'd have to go to Winnipeg or to urban centers to have this done, is this a service you might consider putting in this clinic for the North?
Absolutely. Amanda Lathlin was a tireless and a fierce advocate for survivors. She is the reason that we have sexual assault nurse examiners now practicing in the North. She is the reason that we have legislation that prescribes by law that we must do a better job of understanding who it is that is accessing this care, that care is being delivered in the North, so that in particular young folks, that minors are not forced to leave their communities for this type of care. That is the direct result of her advocating for many years, including when we were in opposition, and then bringing forward legislation that was passed under our government. So yes, most definitely, having access to sexual assault care will be a part of this model. But one of the things that we learned from Amanda and her advocacy was that it's so important that there's no wrong door, there's no wrong place for a survivor to access those services, to get that care. And so we've done a lot of work to enhance access to this care in community. And that is more work that will need to be done and will be done in the North. I want to thank all of the nurses who have taken the training, who have skilled up to deliver this care in the North. And this is part of Amanda's incredible legacy, is that survivors are getting better care close to home, and particularly young folks are not being forced to leave their communities to get this care during a really, really crucial time.
Thank you so much.
And that's all from Zoom. We'll turn it back to the room.
Okay, thank you.
Well, thank you all.
Thank you, Mayor.
Yeah.